Welcome to Autism ADHD TV. It is the place to be for parents and professionals. I'm your host, Holly Blanc Moses, the mom psychologist who gets it. We dive into all kinds of important information like behavior, social skills, and learning. All right, let's get started. Welcome, Dr. Jerrod Brown, back to the Autism ADHD podcast and Autism ADHD TV.
Honored to be here. Thank you so much for having me back today.
I love that you're coming back. You are a bit of a regular. You're in great company with Dr. Tara Regan and also Temple Grandin for being on a third time. So
Fantastic.
Welcome back. Yeah. And so I'm going to introduce you. I know a lot of our watchers and listeners already know you, but I'm going to introduce you for those who are new. Dr. Jerrod Brown, PhD, MA, MS, MS, MS. I love doing that. Is a professor, trainer, researcher, and consultant with multiple years of experience teaching collegiate courses. Jerrod has completed 4 separate master's degree programs and holds graduate certificates in autism and other health disabilities and traumatic brain injuries. Jerrod has published several articles and book chapters. And we also know that you do consulting, which is also very cool and good to know for my audience. Today, we're going to talk about sleep. And I know a lot of people that are listening right now are like, yes, as soon as they hear me say that, yes, because sleep is something that impacts a lot of kids and teens on the spectrum, a lot of kids and teens with ADHD. So you want to get into it with, what do you want to start with first?
Probably start with an overview of sleep disorders in general, maybe a little bit about the benefits of sleep, where I know a lot of people probably know many benefits, but I'll maybe share a little bit more why this topic, I think, is number one to all interventions, in my opinion, starting with getting sleep under control.
I love that. And I agree. Okay, let's get into it.
So if you are raising a child or you have an adult who is on the neurodevelopmental disorder spectrum, autism, ADHD, intellectual developmental disabilities, and so on, individuals with those diagnoses have significantly higher rates of sleep disorders compared to the general population. But if we were to just look at the general population too, sleep problems are very, very common, and it can impact people of all ages. It's not just going to be young kids. It can be elderly individuals as well. It really is a significant societal issue that can lead to a host of safety concerns. It's very costly to employers because people calling in sick a lot, sleep issues may be a factor in some of these cases. A lot of times, sleep issues are really misunderstood or underdiagnosed, or they can look like a whole bunch of other disorders when in fact maybe the person's just chronically sleep deprived or not diagnosed effectively with like sleep apnea, for just giving one example. It can contribute to a lower quality of life. It has been linked to several mental health issues, physical health problems. It's a driver for chronic low-grade inflammation. I'll talk about why that's very important today. But if we were to break down just like the basics of sleep, let's say we sleep 8 hours a day. That comes out to about 56 hours a week, 240 hours a year, and just under 3,000 hours in the entire year. So that's about 1/3 of our life we're sleeping. So it is significant. It's important. There have been plenty of cases I've consulted on where individuals have not slept well in decades. Some folks I know haven't slept well in 30 or 40 years. All of those things can wreak havoc on the mind and the body. So we know the benefits of sleep are many and varied, but just in case your audience isn't familiar with some of them, if you have a child who has concentration issues or ADHD-like symptoms, the research really points to the fact, rule out sleep issues or daytime fatigue. That could be a factor that's exacerbating some of these problems in some cases. Again, what I'm talking about today is just general education, so I really encourage you to talk to your healthcare provider. Maybe you are someone who is very athletic. There's plenty of research to support the fact that getting better sleep can improve academic and athletic performance. Positive image, interestingly, there's plenty of research literature too. If people are chronically sleep deprived, that can have a real negative impact on overall self-esteem and self-worth and self-image. On the flip side of that, getting sleep under control has actually been shown to help improve mood, self-image, overall outlook on life. If you are someone or you know someone who deals with high anxiety or depression or some sort of mood-based disorder, a lot of times sleep issues co-occur with those. And the research also points to the fact that getting sleep under control could be a very helpful factor in managing depression and anxiety more effectively. I'm not saying it's going to make it go away completely, but the research really leans to the fact that it can make it a lot better. Creativity is linked to better sleep. Obviously, having better energy, better stamina, higher levels of grit, being able to stick with a goal, just having better motivation in school are really all linked to having better sleep. On a medical level, looking at this through like an inflammation lens, as I mentioned before, and even hormones. Getting better sleep can regulate hormones. It can keep inflammation at bay. It can help wounds heal. It can help protect us more effectively against illnesses and so on. It has just a profound impact on our digestive health system, our brain health, our memory, our executive function. It helps us have higher levels of resilience. So, Holly, those are just a few reasons why I think it's imperative to learn about sleep. Anything you would add to that list that I forgot?
Well, you covered a lot, and sleep is so, so important. And, this commonly comes up with my patients. And when I'm interviewing parents, and they'll say, my child isn't sleeping, or they have a hard time going to sleep, or they could have a hard time staying asleep. I'm glad that you had brought up sleep apnea earlier on. I know it doesn't happen often, but sometimes children have been diagnosed with ADHD, and later we found out that it was sleep apnea, and they were symptoms they were experiencing due to not sleeping well, right? Once that
Absolutely.
sleep was addressed. So sleep, I feel like, is one of the main issues that we have to think about. And when someone comes and sees me, we need to talk about sleep. If sleep is a problem, we have to look first at ruling out any kind of medical problems and any medical reasons for those sleep problems. And once that's the case, we can go into looking at treatment. But like you said, I'll see increased challenging behavior. And why that is such an issue is not the challenging behavior alone, but how it's impacting that child's life. So if that child is not sleeping and they're more irritable, or they can't focus, and they have these maybe more disruptive behavior, hey, pay attention, behave, all these things that are somewhat out of their control because their body isn't getting the sleep that it needs, and then they're in trouble. And then and now they're stressed and they can't fall asleep. I mean, it impacts everything.
It absolutely does. Head to toe, everything, and the family and the community sometimes.
Definitely. And I've had parents too with children with severe sleep disorders. They can't sleep. Right.
Yeah, if
So
the
then you have a
child's not
whole
sleeping, yeah,
family.
the whole family system's impacted.
Exactly. And so the parents are completely worn down and exhausted. The child's exhausted. And then parents are maybe feeling pressure from the school because their child can't get to school because they haven't slept. And like you said earlier, too, that can impact the parents' work as well. And it really has a major ripple effect.
It does. I've done a lot of work in the area of sleep through many different lenses, including through the neurodevelopmental lens. But There's plenty of research to support the fact too that chronic sleep deprivation in that entire family system in some cases could be a risk factor for domestic violence, child abuse, family conflict, harsh parenting practices. And by no means am I saying someone sleep deprived are going to do that, but some research points to the fact that it really can lower one's resilience and make them more prone to just feeling more irritable, more frustrated, lacking kind of more stress tolerance. So there's many benefits as to why we need to learn about sleep and implementing it, not just for your child, but for the entire family system. Insomnia probably being the most common one that we all experience from time to time, but the research also points to the fact it's going to be more probably that most common disorder you're going to see in children with ADHD. There is something called parasomnias that just be on the lookout for and work with a sleep specialist, your medical doctor, but parasomnias are more like unusual behaviors during sleep or like abnormal behaviors or even unpleasant behaviors while someone's sleeping or as they're starting to fall asleep or right when they wake up. So parasomnias are an interesting topic as well. It's something just to be on the lookout for and be aware of. Depending on what research you look at, Holly, it really leans to the fact that as many as 70% of children with ADHD may exhibit some form of sleep-related concerns. And it's not just one type of sleep issue. A lot of times there's many different complaints going on. If we compare that 70% to the general population, that number is astronomically higher. And there's also plenty of research to support the fact that just chronic lack of sleep can mimic ADHD-like behaviors. So you kind of alluded to this. There's some evidence to support the fact if you're a professional, you're a school teacher, you see a child that has a bunch of behavioral problems, cognitive performance issues, even aggressive and disruptive behavioral patterns. In some cases, they may be chronically sleep deprived, and referring that person to a qualified sleep specialist and getting those sleep issues under control may help bring down some of those behaviors. And interestingly, too, sleep issues, just think of it like if someone's chronically sleep deprived, they're already dealing with ADHD or some other disorder. It is like putting fuel on the fire in terms of like externalizing behavioral problems. So disorder behaviors that you can see that are more disruptive, usually they get worse. But also on the flip side of that, there's higher levels of internalizing behavioral problems, more loneliness, more depression, more isolation, more anxiety. So those inward experience symptoms are often exacerbated too when sleep issues are at play. Holly, there's a million reasons why sleep issues can happen for the general population, for people with ADHD or other types of neurodevelopmental disorders, but ruling out family factors, looking at any stress that's going on within that household. From a medical lens, working with your medical doctor, there could be some circadian rhythm misalignment going on where the person has a tendency to want to stay up all night and sleep all day. During the pandemic, in these last few years, sleep issues are on the rise in general, and it can really throw off sleep patterns where people aren't getting natural sunlight, their eating habits are off, they're looking at the screen really late into the evening. All of those factors can throw off sleep. Even certain medications. I'm not a medical doctor. I would recommend talking to your medical doctor, but there's certain medications that could impact sleep in some cases. There's a host of medical reasons for sleep issues as well. Could be food sensitivity, could be chronic body pain, it could be untreated digestive health issues, headaches, dental pain. I mean, all of these things have been shown to impact sleep as well. So all of these factors, if gone unaddressed, can oftentimes increase academic performance issues in this population. In some cases, it could be a factor as that child gets older to contribute to some truancy-related issues, increases in anxiety and depression. It could be a factor in some cases as that person gets older to maybe start engaging in more self-medicating behaviors, alcohol, drugs, caffeine, tobacco, sugar dependence. All of these factors too, if someone's sleep deprived, it may contribute to more obsessive compulsive tendencies, rumination, again, higher levels of family conflict and more behavioral concerns, again, Holly, just to name a few.
It really does. It really does impact everything. And Jerrod, I just realized that for those who are watching on Autism ADHD TV, my mug says mommy needs sleep. So I just think that's timely that I happen to have this mug this morning because, I'm talking as not only a psychologist that provides mental health services for neurodivergent children and teens, but also a mom of two differently wired kids. And their sleep is hard. It is hard for those parents that are listening. It's, of course, number one, the kids don't feel good, right? They do not. And you mentioned even medication earlier. We were trying a new medication for our youngest. He has severe ADHD. And his stomach started hurting this morning. He didn't get a lot of sleep last night. I tried that stimulant for the weekend and impact him today. So he's actually still in bed right now as we're chatting. So after you and I jump off, I am headed to see if he will be going to school today. But it's a lot. I mean, it really can impact, again, kids in a variety of ways. How do you get a kid who's exhausted, to go to school? And then, it may even look like school refusal, for instance, this morning. But really, it's this super tired kid who's just exhausted. And we were trying to figure out what, if this medication would help him being able to attend more in school, which is what he wanted to. So we're working on it. But again, it's not easy for any of us.
So many layers to this, and parents, I just feel for parents too with this lack of sleep. I've heard horror stories. I just hate to use that word. I've heard horror stories about just lack of sleep and how it makes everything so much more intense. So self-care strategies are important for everyone in that entire household. A couple other things just to put on people's radar that could be factors in sleep issues. Again, really looking at it through any type of stress lens. Is there any conflict going on at school for the individual, on the playground, in the bus? Is there bullying and teasing going on? There's so many articles that have been published on the link between peer victimization, getting bullied and teased, and how that can impact sleep in and of itself. Is there any conflict going on at work? Maybe there's some fears. Fear can absolutely get in the way of getting a good night's sleep. Anxiety of any type, even emotional arousal issues. So our central nervous system being overactivated, so it activates our sympathetic nervous system and we just become more hyper aroused. Any arousal issues like that. Watching, again, maybe it's programming, TV, YouTube videos late into the evening, and it could be something very stressful or anxiety provoking for the individual, and they might not even connect the dots there. Looking at any fluid consumption too, particularly late into the evening, could be a factor. There's a case I consulted on a few years ago where the person was diagnosed with a neurodevelopmental disorder, and the professionals just wanted some of my opinion through a sleep lens. And what was figured out was this person was drinking 2 large glasses of water right before bedtime every night and not telling anyone. So this person was getting up 2, 3, 4 times a night, having to go to the bathroom throughout the night. Another case I can remember where the professionals referred the individual to a sleep specialist, and they realized the person had an allergy to an animal, and the person had an animal sleep in their bed with them every night. Even mold or just having the room too damp too dry, too hot. Those are factors that can get in the way as well. So again, the factors are really many and varied. If you were to go through all like the articles on like neurodevelopmental disorders and sleep, some other factors that consistently come up is even learning disabilities. Untreated learning disabilities could trigger increases in stress, anxiety, and worry for the individual, and actually cause an increase in sleep problems. Ruling out any co-occurring mental health issues would be highly recommended. Ruling out any upper airway obstruction. There's a couple cases where I know the person had a history of falling on a bike and breaking their nose, and that actually caused their nasal passage to not work properly, and it really got in the way of like getting proper oxygen into their system. So again, another reason why to work with a qualified sleep specialist, and even going to the dentist. The dentist plays a huge role in like looking at red flag indicators for possible sleep apnea. Ruling out anything going on that's not working properly in the digestive health system would be highly recommended. Maybe ruling out sensory processing issues. There's a big link between that and sleep issues. And just looking at overall developmental delay, that could be a factor in some cases. And if you're a caregiver, just being on the lookout for any stress that's going on with you or your family as well, that could be contributed directly or indirectly to that child not being able to get a good night's sleep. I can think too, Holly, a couple cases I remember, just interesting things that came up where the child had a long history of different health and just problems early on in life, where they had a lot of allergies, ear infections, things of that nature, where working with a medical health provider was very helpful in that case. So again, whatever's causing that person discomfort, worry, fear, emotional pain, physical pain, those are all factors that can absolutely get in the way of one's sleep.
And, you and I talk a lot about all those different variables, and it probably feels overwhelming to those who are listening and watching right now, but it's just one thing at a time. And so first, as we talk about treatment, first, let's look at medical, right? Let's look at medical first, and let's talk to the dentist. Let's talk to the general pediatrician. Let's figure out if there's anything happening medically, because it could be, like you were saying earlier, it could be a combination of things. There might be a medical reason, there might be a medical variable impacting it, but it also may be an issue of mental health as well. And possibly even medication. Maybe, they're taking a stimulant booster and it's a little later, then it's causing sleep problems. I mean, there's just so many different things to think about. So first, kind of look at those potential medical causes. And then once we can get a handle about that, we can move forward with the others. So for, again, those parents that are feeling overwhelmed right now, that's always a good place to start.
Yep, perfect. Start small. I can't agree more. Medical, looking then just environmental stressors. What is going on in the environment, in the home, right outside the home, on the playground, on the school bus? Maybe it's working with a nutritional counselor or nutritionist or functional medicine specialist too. A big connection between what we put in our body in terms of food and how that can impact our overall health. So again, digestive health, maybe it's food sensitivities. I mentioned about what does someone consume in terms of fluid consumption? Are they drinking sugary beverages all day long? Are they drinking caffeinated beverages all day long? Smoking habits, sugar habits, those kind of things. But also looking at anything socially or emotionally going on for the individual as well. Interestingly too, attachment styles have a lot to do with this. Any histories of trauma, emotional trauma, things of that nature can really impact sleep health as well. And it does get overwhelming. There's a lot of factors to take into account here. I've been studying these topics for many years. If someone's fresh to this, again, it probably sounds very overwhelming, but through an intervention lens, again, working with a qualified specialist who understands these topics. But typically, in my experience, a lot of these things really need to be tailored to the individual's strengths and limitations, because everyone you meet with is going to have unique experiences. So tailoring it, taking into account their emotional and developmental age, I think is very important too, because just because the individual is, say, 16 years old chronologically, that doesn't mean their brain functions as a 16-year-old. Maybe their brain functions as a 10-year-old or a 12-year-old. So tailor the approach to match their emotional, social, and cognitive age. I think it's important too to be flexible, just realizing sometimes things might not work, being adaptable, being trauma informed, I think can be helpful, becoming attachment informed, and doing this with a multidisciplinary team of professionals. I can't think of any one professional who would understand all of these topics, really pulling in different professionals, medical doctors, a nutritionist maybe. Maybe it's working with the psychiatrist regarding the medications. Maybe it's working with an in-home counselor or a speech language pathologist or a sensory processing specialist. Again, the list goes on. And Holly, when you dig deep into this research, you'll probably hear like sleep hygiene practices. Just again, sleep hygiene is really focused on looking at what factors could be contributing to the individual's sleep problems. Like, what's their sleep schedule like? Do they have a really erratic sleep schedule? Some of this research points to the fact that consistency and structure and routine in one's sleep schedule is a very good starting point. So going to bed the same time and getting up the same time every day, not just Monday through Friday, but Monday through Sunday, getting that consistent pattern. Some research also leads to the fact too, just getting up in the morning, going outside, getting natural sunlight, getting fresh air, getting off the screen and the gadgets, particularly right around sunset in the evening, getting movement through the day. People who live like a sedentary lifestyle are more likely to have sleep problems, interestingly too. Anything too, Holly, I think just infusing relaxation strategies into our day. Anything we can do to bring down our stress. Maybe it's yoga, maybe it's meditation, maybe it's deep breathing. Things of that nature have actually been shown to help bring down muscle tension and reduce anxiety and just reduce stress and negative emotions. All those things can help people really get a better night's sleep. Holly, would it be helpful too to just talk a little bit about like just some things on how to create more balance in the parasympathetic nervous system?
I think that is a good idea. Before we talk about that, and this will be related to where you're going, I believe, is sleep hygiene, which sounds like a strange term, right? When we think of hygiene, it's like showering and those types of things, but it's what works for your individual child or your individual client. I'm just going to personally say what happens with my 12-year-old for his sleep hygiene. Both my kids need to turn their phones in at the same time. We call it turning it in. They go on the charger in the living room at the same time every night. Then what we'll do is go ahead and go through like night medications and getting ready, in general, teeth brushing, all those kinds of things. For my 12-year-old, he requires a couple of weighted blankets. That's really helpful for him. Hopefully the OTs aren't freaking out right now because it's probably a little heavier than maybe it should be, but that's what he needs because we've tried different weights and he requires a higher weight. And then he also has the fan and the white noise. I mean, there's a whole deal. So when we're talking about sleep hygiene, it's really the routine that works best for that particular child.
And anything you do to optimize that sleep environment. Holly, you mentioned a few things, but really what is going on in that sleep environment? Making sure the mattress is comfortable, the pillow's comfortable, keeping technology out of the bedroom is highly recommended. Getting that light out of there, getting the noise out of there, I think is very, very helpful. And anything you can do to implement like a calming and structured bedtime routine to help make bedtime routines less stressful, and getting people interested in actually getting a good night's sleep, I think, is a very helpful approach. And you might have probably, some of you probably heard of the term like cognitive behavioral therapy for insomnia. Maybe seeking out a specialist who has some advanced training in that area, who also understands like ADHD or other neurodevelopmental disorders. That's a really gold standard intervention approach for people with insomnia as well.
Definitely. And there is, you were talking about relaxation earlier. I like the app Headspace. They have some pretty cool kid mindfulness sections on there that you can use as far as sleep too. So that's, I think, can be very helpful for kids to not only be able to help relax them and keeping the blue light away or turning it down while you're doing the exercise, but also that's something they can take with them throughout the day and teach them skills on how to calm their own bodies and be more self-aware of what thoughts are popping up for them. Because you and I both know, and I know our watchers and listeners know, that we are so distracted and busy during the day that our stressors often really hit hard at night, because we're laying there and we're not busy, we're not distracting ourselves. And so all the brain stories and the uncomfortable thoughts, they're all right there for us.
One thing that helps with that the research shows, is journaling your thoughts down in terms of what you need to get done the next day has been shown to take it off your working memory so it doesn't get stuck on there. And then you start ruminating about it. Obviously, easier said than done. We all have that happen from time to time. But anything like when we start getting more tense in our body, we're starting to have more racing thoughts, our nervous system is kind of kicking on. Maybe our sympathetic nervous system is kicking on a little bit, and we're starting to have more stress go through our body, higher levels of cortisol. Maybe our HPA axis starts kind of going into overdrive, our hypothalamus, pituitary adrenal axis. In those situations, anything you can do to help more restore balance to the parasympathetic nervous system, and I don't want to get too far deep in the weeds for you guys today, but just that basically creates more of a balance, more calm, more homeostasis back in the body. So a lot of this stuff is common sense, but deep breathing has absolutely been shown to be helpful. Meditation, just sitting still and just getting distractions out. It might be a little uncomfortable at first, but I've heard amazing stories too. People can kind of get in that rhythm, their body and mind get used to it. Staying organized, setting realistic goals, deep stretching, yoga, but again, talk to your healthcare provider before implementing any of these things. Creating balance in one's life too, and improving coping skills. Even going to a therapist and talking to a therapist or talking to a trusted loved one or a good friend about what's going on, those things can help regulate the body more effectively as well. And anything we can do to improve self-esteem, our confidence, and just being aware of nutritional factors that may play into this as well. So working with a nutritionist, and even getting a massage or deep tissue massage has been shown to help with some of these things too. So those are just a few tips that consistently come up in the research literature.
And I'm glad that you had mentioned massage, because I know some parents that I work with do have that as part of their sleep hygiene routine with their child. They will kind of take some oil and sort of rub down their child with, their feet and their legs to help them relax. So I'm glad that you brought that up. And again, sleep is more complicated than we typically think. It's complicated, but one step at a time to address it. There are different things that you can use. I'm a fan too of one of the changing colored lights. There's a few brands out there, but to show the child when it's time to get up. And because sometimes their bodies don't understand when that is. Or maybe there is a clock and you put a Post-it note when this number matches this number, it's time to get up. So there are lots of different things that you can do, lots of different strategies. But number one, check out medical, be mindful about anything happening in the environment. Again, mental health, like you mentioned earlier. And, like you said, COVID, it's really stressful. So here we have a situation where kids have never been having to deal with this before. I'm going to school, and what if I get sick? What if I get sick and bring it to my family member? What if the child next to me doesn't wear their mask properly? I mean, there's so many things that I hear in my office that have really brought out a lot of stress for kids.
Confusion, uncertainty, those two factors alone can wreak havoc on sleep health. So, and COVID has really amplified those. And I hear these stories all the time as well.
Definitely. Is there anything that you wanted to add for our watchers and listeners today, Jerrod?
Know that there's so many resources out there, online, books, different specialists who understand sleep health. Now, there are fewer that understand sleep health in conjunction with neurodevelopmental disorders, but there are some. Anything you can do to improve sleep, work with a nutritionist, getting proper exercise, even staying hydrated. There's plenty of research too that like chronic low-grade dehydration could be a factor. Managing stress, managing healthy, appropriate body weight, I think too. There's lots of research that says regulating one's blood sugar levels and not letting things spike too high or go too low. Supporting brain health and supporting gut health is going to help a person in, I think, all facets of life. But again, what we're sharing today is just basic education. Please work with your healthcare providers before implementing any strategies.
Definitely. And thanks again so much, Jerrod, for coming on and speaking with us today. You are such an amazing resource. And I know that we all appreciate it. And I also really appreciate your approach, and that knowing this is not easy. It's not easy for the kids. It's not easy for the rest of their families. And sometimes, again, it can feel overwhelming. Like, what do we do first? And how do we do this? And what if we can't find a provider? So hang in there, everybody. Again, one step at a time. It can get better when you're working with the people who understand this population. So again, thank you so much, Jerrod. And I hope you come back and talk with us again.
Thank you so much for the opportunity again.
Okay, I'll make sure to have your contact information in our notes section. And so all of those who are watching and listening know how to get a hold of you.
Awesome. Thank you, everyone.
Thanks, Jerrod. Bye-bye. Thank you for joining me today. Don't forget to click that subscribe button so you don't miss any future episodes. If you like this episode, please share it with someone. It may just be what they need to watch today. If you're a parent, I'd love if you came on over and joined our Facebook group, Autism ADHD Group for Parents. If you're a therapist or educator, come on over to our group, Autism ADHD Group for Therapists and Educators. You're going to find those links right down there in the notes. Thanks so much, and I can't wait to see you in the next episode.
All content provided is protected under applicable copyright, patent, trademark, and other proprietary rights. All content is provided for informational and educational purposes only. No content is intended to be a substitute for professional medical or psychological diagnosis, advice, or treatment. Information provided does not create an agreement for service between Holly Blanc Moses Crossvine Clinical Group, the interviewee, Holly Blanc Moses LLC, and the recipient. Consult your physician regarding the applicability of any opinions or recommendations with respect to your symptoms or medical condition, or the symptoms or medical condition of your family member. Children or adults who show signs of dangerous behavior toward themselves and/or others should be placed immediately under the care of a qualified professional.